My constituents, who you suggest I'll hear from, are unfortunately getting misleading information about the bill. In particular, people who would be, quote, kicked off of Medicaid. There's been misleading statements and fear-mongering galore about the safety net, quote, being ripped out from under our most vulnerable, disabled veterans, sick, pregnant mothers, et cetera. I think personally, and I'm not directing this just at you, but as the Democrat witness, I'm telling you, it's a gross mischaracterization. That's polite language. And I think it's preying on vulnerable people to say that. So what I did was because the statements have been around CBO, the Independent Nonpartisan Congressional Budget Office's analysis or statement of the 7.8 million people who would be without Medicaid as a result of the passage of the One Big Beautiful Bill as it was passed out of the House. But I needed more information, so I sent a letter along with Chairman Guthrie. Who are those 7.8 million people being, quote, kicked off of Medicaid? Well, I've got the letter here. This is the same nonpartisan, independent CBO that was referenced by my Democrat colleagues. And they state very clearly that the 7.8 million people are people who are able to work who refuse to work, legally ineligible, but we don't do or haven't done the sort of program integrity implementation and enforcement like verifying people's eligibility, or they qualify for some other government subsidized health insurance, or 1.5 almost million people are here illegally and should not benefit from taxpayer-funded social services. We're having a tough time with $36 trillion in debt, $2 trillion in annual deficits, $1 trillion in interest, and a future insolvent Social Security trust fund along with Medicare and the list of disastrous concerns into the future on fiscal sustainability of these programs continues. But that's it. They literally say, CBO estimates that enacting Medicaid provisions in Title IV of the H.R. 1, the Big Beautiful Bill Act, will increase the number of people without health insurance by 7.8 million by 2034. Of that number, 4.8 million are people who are able to work who refuse to work. Of that 7.8, 1.5 million almost are here illegally. 1.6 million are ineligible or are eligible for another government subsidized health insurance and refuse to get it. So we need to set the record straight. I've taken enough time. Anyone can read this for themselves. We sent the letter requesting this information June 18th. We just got it yesterday, June 24th. I encourage everybody not to submit it for the record without objection. So ordered. Brian, you talk about the healthy relationship between the state and feds for good fiscal management of programs. That doesn't exist anymore. In fact, it's worse than we thought with respect to Medicaid. And states bilking money in cahoots with providers and other groups, locally, insurance companies. Talk about that and how out of control it's gotten and why it's so important that the Senate goes even further to lock out these schemes that are hurting the vulnerable people's safety net into the future and also wasting tax dollars.
Yeah, I mean, thank you for that question, Mr. Chairman. Underpinning Medicaid has been a shared responsibility between the federal government and states, where states historically paid about 40% of the cost, which meant they had skin in the game. They had agency to care about the value of the spending. There's been two real problems that have distorted that relationship. The first is the economics of Obamacare. States are getting $9 in federal funding for every dollar that they spend on the expansion population, which is on average 7 times more in federal funds that they get for $1 of spending on traditional enrollees. And the second is the growth of this very abusive money laundering system. The way it works is that the hospital, I'm going to use hospitals as the example, but hospitals will lobby to be taxed. So you know it's not an actual tax. And so the hospitals will send, say, $1 million to the state. The state sends that $1 million right back to the hospital. That's an accounting gimmick, but the state then invoices the federal government. And the federal government on average is spending, 70% reimbursement. So they're able to get $700,000 of federal funds for what is an accounting gimmick. Under the Biden administration, that accounting gimmick exploded, and the payoff to these very powerful hospital systems are rates that are magnitudes above Medicare. So we have a huge amount of corporate welfare interjected in this program because that's what the federal government has incentivized states to do.
Thank you. And Biden and Obama called it a scam. They were right, and we ought to address it. And I yield 5 minutes to my colleague, Mr. Boyle.